I'm excited today to introduce your experts who are going to answer our questions about sleep strategies from newborns to teenagers. First off, we have Dr. Ignacio Tapia. We're so glad that you're here. Welcome, Dr. Tapia.
Thank you for having me.
We're so thankful. I want to tell our audience a little bit about you. So Dr. Tapia is the chief of the Division of Pediatric Pulmonology and Bachelor Professor of Cystic Fibrosis and Pediatric Pulmonology at UM. He is also the Pediatric Pulmonology Fellowship Director, and he graduated from University of Concepcion, I'm testing my Spanish there, Chile, and completed his pediatric residency and pediatric pulmonology fellowship at Children's Hospital in Philadelphia. He is board certified in general pediatrics, pediatric pulmonology, and sleep medicine. So his main research interests are the pathophysiology. You're going to have to help us with all that. That's why you're the expert of the obstructive sleep apnea syndrome, or OSAS, specifically in children, and clinical trials focusing on treatment of OSAS in children, health disparities in pediatric sleep, and the consequences of OSAS in individuals with Down syndrome. So lots of expertise in this very specific topic we're talking about today. He also chairs the Career Development Awards at the American Academy of Sleep Medicine, and he's a standing member of the Biobehavioral Medicine and Health Outcomes NIH study section. He is also a member of the Pediatric Sleep Council. So I think you know a thing or two about sleep. If your bio proves true, I think so. I'm excited for that. Also help me welcome Dr. Amber Henry. Dr. Henry, welcome.
Hi, good morning. Thank you for having me.
Yes, thank you for being here. So Dr. Henry is a current third-year pediatric resident at Holtz training program, and she hopes to pursue primary care in her future. She graduated with a liberal arts degree in English with a focus in medieval studies. That's so awesome. I have so many questions about that for you on another day. Her current pediatric career goals focus around resident education, preventative care, sleep behavior, and also breastfeeding support. So Dr. Henry, thank you so much for being here. Well, I have to say, I think I have the best seat in the house because I get to sit right here with you and have this conversation. But all of you who are listening in, you have the same privilege because, again, you can ask any question you'd like in that Q&A feature, and I will get it in front of our experts. So I have a 7-month-old baby, and we are really struggling with sleep right now. And I've had other babies, no problems. And so I'm sitting here racking my brain. So I am super excited for today's topic, and I am personally invested in this. So without further ado, let's dive in. And my first question is, let's talk about infants, and we're going to go the whole gamut up to teenagers. So let's start with infants, and how much sleep does an infant need, and how much does, a child need as they get older? So kind of that spectrum. Dr. Tapia, you want to take that one?
Yes. So actually, infants and all of us, we can vary significantly in the amount of sleep that we need. But typically for a newborn can be between 14 to some of them 20 hours and a little bit more. That decreases until the age 1, in which infants of 1 year of age can sleep between, for example, 12 and 16 hours, even some a little bit more. And then that continues to decrease until the adolescent years when we sleep between 8 and 10 hours of sleep. So it all depends. It's not unheard, actually. And I saw that, and maybe Amber had the same experience as a resident. Families coming to the emergency department because the baby was asleep and they couldn't wake them up. And you do the entire workup, and the baby looks normal and wakes up appropriately. So it's normal within certain limits to sleep a little bit longer for babies.
That's great. That's great. Oh, to be a baby again is what I'm thinking. I wish I could get that much sleep. Okay, how can we tell if our child is getting enough sleep? And what are some major signs of poor sleep in children? Dr. Henry, would you address that?
Yeah, it's a really great question. And it really depends upon the age of the child and the specific child themselves. As pediatricians, we are specialized in this area, but as parents, your children the best. And so it depends on each child. Typically, in the more toddler range, we like to say wired is tired, right? So if they're very overly hyperactive with increased irritability, that can suggest lack of sleep. Sometimes you can even see frequent nighttime wakenings or early morning wakenings.
That's good. I love that. Wired is tired. I've never heard that, but that's a good little, I'm going to write that on a card. I feel like that's, oh, sorry. It cut out.
That's
Oh,
fine.
go ahead. Sorry.
No worries, Sarah. We like to say early to sleep is late to rise. So sometimes we can adjust, their sleeping time and their sleeping onset, and that's something you can do with your pediatrician. And then in older children, we can see poor school performance, drowsiness as well, and irritability, of course, just like we get irritable when we're sleepy. Same types of things. We like to follow sleepy cues for nap and bedtime onset. In the younger children, like eye rubbing, yawning, they're staring off, they're not as interested in their activities or irritability, that can suggest that maybe it's time for nap time or for bedtime.
That's good. That's good. Sleep begets sleep. You kind of think it's counterintuitive, but
100%. Yeah.
that's right. Okay, let's talk about, I'm already getting some audience questions, which is great. And I'm going to get to that in 1 second. But first, tell me co-sleeping. There's a lot of talk about co-sleeping. Is it dangerous for infants? Is it ever advisable at any point in a child's life?
Yeah, actually, it can be dangerous for newborns and infants, and there are reports that associate co-sleeping with sudden infant death syndrome. And this could be simply because, as infants, when we're born, our rib cage is very, very floppy. So it's very easy to collapse the rib cage, and then you don't have air getting into the lungs. So it is possible that if the bed is very soft or a parent turn over the baby, prevent the baby to breathe normally, and the baby cannot fill their lungs. So it's not advisable. The safe practice to sleep is back to sleep. That's the best slogan ever. Remember, back to sleep.
Back is
Baby
best.
can be on the bassinet next to the bed, but alone. Older kids, I mean, they don't have that issue. If there's a cultural situation that the family wants to sleep, that would be okay. It's not a benefit. It's not necessarily a detriment in older kids. It can be when parents, and we see that in the sleep studies, by the way, many times, and by the way, you're going to get a sleep study, do not go sleep with your baby on that night because it affects all the signals. They have a bunch of signals, and we see, for example, the parent may be snoring loudly and it gets into the microphone, so it changes the signal. Or sometimes they turn and, like a full-grown person, and you have like a 5-year-old, boom, in bed, and the baby, boom,
Yeah. Okay.
jumps.
Yeah.
And we see that on the video, we see that on the signals. So it's not something that we recommend. But for infants, please don't do it because actually that can be dangerous.
Awesome. Yes, that's good. All right. Talk about just some safe sleep practices in general. Back is best. I heard you say that, back to sleep. But tell us some other just safe sleep practices.
It's for me again, right?
Yeah, that'd be great.
So back to sleep is the most important one. And also some safe sleep practices, not to have a lot of objects that can get on the way of the infant. Something that is very important. I know culturally people like to graduate kids to the toddler bed. Keep them in their bed, the toddler bed, I say jokingly to parents, until they go to college. Until they don't fit anymore, honestly, because you're creating a world of problems once the kids can get off bed. And obviously they can get in situations that are not safe, or they can start walking around the house or things like that. So leave them with the bars high until they really don't fit anymore, and then you can get them into the bed. You don't want them falling off the bed or things like that. Also, the things that you have in bed, many times the families have many stuffed animals. Those are not really that good because of the risk of suffocation. If you think about a little baby cannot really push something off their head, so
That's
it's
right.
not good. So all that area, it is the breathing has to be like really, really, safe and free of anything of big objects or objects that can get into the airway.
Yes, that's great. Very good. What about, Dr. Henry, tell us about sleep accessories that would be okay to use and at what age certain
Right.
things are.
Yeah, it's a great segue. So we want to optimize safety of sleep, but also, efficacy of like helping your child to sleep. So I'll go through a few different accessories. The first of which is the pacifier. The pacifier is actually SIDS protective, so it helps reduce the risk of SIDS. We typically recommend that you introduce the pacifier if you care to use it around 1 to 3 weeks of age, especially if it's a breastfed infant. We like to get them their suck associated with the breast, and sometimes the pacifier can cause confusion. So we typically wait at least a week. It's great for soothing. We do recommend you just continue it by 6 months to a year of age. The American Dental Association recommends, maximum of 18 months. It can really affect the bite and the teeth. It also has seen association with language challenges. Recommend pacifier is really only for sleep. You don't want it, daytime. There's no quite need for that. The swaddle is great. It recommends the
Love
startle
the
reflex
swaddle.
that all babies have. And there's a few different brands, Ollie or just the regular cloth. I know different moms prefer different things. From my baby, we used the Ollie, but definitely discontinue by 3 months of age or when the baby starts to roll. It does become a hazard because if they roll over, they can't push themselves up to protect their airway. So definitely discontinue by 3 months of age. Some go cold turkey, just remove it. You can also do a transitional swaddle depending upon your preferences and your child's needs. Sleep monitors can be a great resource. Data does not show that it actually decreases the risk of SIDS incidents. So truly it's a family preference thing, especially in a larger home. Or sometimes if the grandparents want to watch, I guess that's, appropriate too.
Right.
But just of note, it can cause some increased anxiety, overwatching of the screen.
Yes.
So true. Yeah, exactly. For me, I was like, I need to stop, right? So it's
Yeah.
truly a family preference. But it doesn't actually, reduce the risk of SIDS. White noise machines we address the white noise machines later in the session.
Yes.
They can be helpful in masking environmental sounds. They provide a nice ambient sound. We do recommend to keep it, as far away as possible from the crib, usually around 6 to 7 feet. Just like COVID, and then maximum volume of 50 decibels, which to the layman's person, that kind of sounds like a quieter
Like,
dishwasher.
how do you know?
Yeah, it's like,
Because
yeah,
those can be loud. I mean, you
it
think
can
like,
be very
oh, is this
loud.
soothing?
And
It's very loud.
correct, yeah, Sarah. And there's kind of new studies coming out that suggest, it might not be the best thing to have this like continuing noise in the background as trying to sleep.
Yeah.
But so we usually just say for onset of sleep, not for the full duration
Okay.
of the night.
Like put
Um,
it on a timer. We'll talk more about that. Great. Sorry,
yeah,
I'm
yeah,
getting
for
into it
sure.
because I'm like, tell
Yeah,
me
use a
more.
timer. A lot of those things are really, and they're pretty smart, a lot of them now. Lovey's in the crib, just like Dr. Tapia said, really nothing in the crib other than the baby before a year of life or until a year of life. So at a year of life, you maybe can introduce some kind of like comfort, like a stuffed animal. Make sure it's not too fluffy, not too big. And of course, if they have like allergies or asthma, we like to minimize the fluffies in the bed.
Okay.
And we definitely don't recommend DockATot, hammocks, crib bumpers around the bars of the crib. That's just a suffocation hazard. So
Yeah.
definitely not those.
Good. Okay. Thank you. There's so many of the added things you don't even think about until you start talking like, oh yeah, there's that and there's that. And I will say marketing is very good on some of these baby products. So
Yeah,
just because it's
be
all
careful.
over, Instagram
Yeah.
or the TV doesn't mean that it's safe. So that's why I value this time with you guys. All right. Dr. Henry, tell us how do we separate association between sleepy cues and feeding times?
Yes, I think this is the biggest challenge in the newborn period. So feeding is in the newborn period, it's very soporific. It's very sleep inducing, especially breastfeeding or either way, you're on the parent. It's warm, it's cozy, you're getting fed. Many infants will fall asleep and that's okay. But our goal at this period, especially after the first couple of weeks, we like to say drowsy but awake. And so when you're putting your infant down to sleep, you want them to feel drowsy and they're sleepy. They're like halfway there to falling asleep, but so that they can last course of sleep onset. We like to separate feeding from actual sleep onset. So if you notice your baby's getting sleepy, go ahead and remove the bottle or dislodge from the breast, and then soothe them and put them down after gripping them, of course. It can be helpful to, if mom is feeding the baby, pass it off to the partner so that the baby can not associate the feed with actual sleep onset.
Mhm.
Um, and then, of course, we always love the 5 S's of sleep: swaying, swaddling, shushing, sucking with a pacifier. And then kind of like resting them on your chest can also be helpful for soothing a sleep.
That's great. That's helpful. Okay, so I want to transition into talking about sleep training strategies. So we've received a question from our audience that says they have a 9-month-old. Is it okay to let the 9-month-old cry it out when he wakes up in the middle of the night? I feel like this could be my question. Like this is my life right now. He's gotten used to me picking him up and breastfeeding him to sleep again. That's what's going on. So help us, coach us through this. And then let's talk generally too about sleep training strategies and are they advised and whatnot.
Right. This is a really, I think, tough question, and it's very personal to each family and to each child, which is going to be, I think, the theme of sleep, but also life.
That's right.
And so there are, generally speaking, are three main styles of sleep training. We have some of the ones that I think many people have heard of. It's the Wise Blues, the more rapid cry it out type of method. So this is the method where you put the baby to sleep and they cry until they fall asleep. So the most important thing about this one is we don't recommend letting a baby cry like on their own without support until at least 4 to 5 months of age. So anytime before this age they cry, you pick them up, you give them what they need. The foundational component of both this method, the Wise Booth method, and the Farber method, which is similar but a little different, is really setting up important sleep time rituals and sleepy cues. So it's not a matter of, putting in the crib and walking away, but you kind of prime them,
That's right.
optimize them for the sleep onset ritual. So we'll adjust the rituals later, but kind of bedtime, nap time, the pattern that you go into should look similar each time. So specifically the Farber method, it's a modified version basically of the cry out method. You put them to sleep, drowsy, you read to them, they're in their pajamas, they're bathed, their teeth are brushed, you put them down in the crib. And if they start to cry a little bit, you re-enter the room at increasing intervals. So let's say you put them down, a couple minutes later, hey, I'm here, it's okay. You give them a hug, you put them back down, you leave again, and you keep increasing that interval. And of course, there's the more gentle, they call it the gentle method, is each time you go up and pick up the baby, but that's not effective of letting the kids fall asleep on their own. It can be very hard to hear a baby cry. You can do modified methods of, you like with your 9-month-old. It's technically okay to let them cry. Studies don't suggest that it's harmful to the child. Part of it is just kind of behavior, giving them the methods to fall asleep on their own, and really optimizing the preceding 30 minutes prior to bedtime so they know it's time to go to sleep.
That's great. That's great. So on that note, and you kind of talked to this, but question is, Dr. Tapia, maybe you want to address it too, but will it hurt my baby to let them cry if they wake up in the nighttime?
As Dr. Henry mentioned, it will not, but it also depends what's going on. For example,
Right.
if it is a baby that never ever wakes up and cries, and all of a sudden is crying in the middle of the night, that there's something that you need to know what's going on. So the rule of thumb typically is to make sure that the baby is safe before interacting with the baby, because maybe it's just having a dream or something like that. If it is a baby that wakes up every night in the middle of the night crying, then there are different strategies, and it depends on what the family wants to accomplish. Because this is very important when we're talking about sleep and any habits. They're not really right or wrongs. It depends on what the family is at and what do they want to accomplish. So not all the recommendations fit every family.
That's
That's
right.
why you
That's
have
right.
to have an individualized plan.
Yeah, that's great because the goal for everyone is not for my baby to sleep independently for 12 hours in the room. Everyone's goal might be different. So I love that you said that. And like you said, Dr. Henry, that's life. Everything's unique to every family. But on that note, because it's like, oh, does it hurt my baby? Like I think it, like you said, unless there's no alarming something going on, it's just hurting mama worse than it hurts anybody. It does hurt mama hearts and daddy hearts too. But I'm not a daddy, so I can't speak to that. But as a mama, it hurts your heart more, right? Okay, I want to add a caveat. When you said to make sure nothing's wrong, what about when you know or you assume a baby is teething? Do you just kind of let them work that out? Is that still kind of work it out? Because that usually I feel like, at least for my happens at night,
In that case, you could do something for that. For example, like the little pacifiers that you can put in the freezer so they can, if you want, like numb a little bit the sensation of the baby or something that they can chew on. Yeah, those are the good times.
Yeah, that's good. All right, let's talk about the importance of a bedtime routine. Dr. Henry, you alluded to it. Dr. Tapia, you speak a little bit more about it too, as well, of just that, 30 minutes before bedtime and how important that routine is.
It's very important because it provides cues, and also it provides consistency. And that's something that we're gonna use all the time, and a structure that we're gonna use all of our life. So it's very important when we're talking to sleep or when we're talking about everything. And I know it's not a popular thing to think that routines will help people thrive, but it has been shown that we humans and pets as well, we thrive on routines. So we know at this time I wake up, whatever, have my breakfast, need to be on my car, go to work. This time I come home, and you start to create these associations, right?
That's right.
So the same thing is important. So you need to create this association with the baby that, okay, it's sleepy time, and now you're gonna be in bed and sleeping, recovering from the day until the next day. So it's very important that it's set up. So it's something that we recommend pretty much for every family. However, the routine may differ from the family.
Yeah, that's good. On that note, we received a question from our audience, and she said her toddler, 2-year-old, when she was sick, she got used to falling asleep in her room, and then they'd move her to the crib. But a week later, the cold is gone, but now it sounds like a new habit has started. So the 2-year-old is demanding to fall asleep in her room, and the mom's like, "I'm just exhausted, so haven't been firm
Yeah.
about it." Like, how can we break this cycle? I feel you. We all feel that way in
Yeah.
parenting, different things we get out of our rhythm. So speak to how we can help this
Yeah.
mom.
So the most important thing is how you fall asleep. So for example, you fall asleep with a pillow this way, with whatever way. We all wake up during the night, adults and kids, can be 1 time per hour. We don't remember, it's very short. We turn in bed and that's it. So if I'm sleeping in my mom's arm, that in my case would be funny if I still do it. If I'm sleeping in my mom's arms and I wake up every 1 hour, and where is this lady? She needs to come here, right? I could
Where
touch
did she
her.
go?
But in this
That would
case,
be terrifying, you know? Like,
if I don't talk, I cry, obviously, and then mom will arrive. So we have to retrain again the baby to fall asleep in the crib, and it can be the routine that Dr. Henry was mentioning as well, like 30 minutes, the baby in the crib, the parent can be on the side, but try to avoid like any physical contact at that time, so the baby creates the association that the crib is where he or she has to fall asleep.
yeah, that's good. Dr. Henry, elaborate some more on like some sample bedtime routines, and then also how that differs from infant to children. Obviously, it's going to look different the older kids get.
For sure, it'll look different as they grow in age. So for I like to break it down into 3 main categories. So your location. So you should have the same place for naps and bedtime. And for the younger kids, it'll be the crib, and older kids, it'll go ahead and be their bed and in their room. Your environment is the second category. You want a cool room. Usually for SIDS prevention in the younger age ranges, we recommend temperatures from 68 to 72, but of course it depends on your home. We want a dark room, quiet room, their environment, they're in their pajamas. When I'm in my pajamas, I know it's bedtime. So same type of thing, you're setting up lifetime associations with sleep. And then the third category is the activities. So your activities immediately preceding bedtime, we recommend a ritual routine about 15 minutes, but the 30 to hour minute before bedtime should be a more calming type of environment. So your recommended activities before bed, you do the ritual of bath time, brushing their teeth. Some parents like singing to their child. That's a very calming, soothing activity. Some families will do prayers, really just spending, intimate, quiet time with your child. And it really becomes a very precious time of the evening. And again, they shouldn't last too long. And then as you advance into the adolescent, like elementary school and adolescent range children, your sleep activities will be different, of course. We still recommend reading. That's always a lifetime love and a hobby that we want to foster in our children. We'll talk about screen time later, but definitely no screen time an hour before bedtime. And again, calming activities, whether it's the showering, the brushing the teeth, getting in their pajamas, tucking in their younger sibling, those can be some helpful activities to children.
That's great. That is awesome. All right, we've got another a parent question. They have an older child, 5, who goes to sleep on their own, no problem, but comes into their bed every night. This mom said, "I'm so tired. How do I fix this?"
That's something that happens pretty frequent as well. And also it depends why the kid's sleeping. Many times waking up, many times they're waking up in addition to what we wake up normally because they have something else. So they may have obstructive sleep apnea or some issue that making them wake. So it's important to counter that up. And if none of that is happening, it may be something behavioral. So it's important to teach the kid to stay in the room. So what they can do, they can set up like what we call like a token economy, like little prizes. For example, for every morning that you wake up on your own bed, you get a little sticker. For 3 stickers, you get a larger sticker or something that the child likes. It doesn't need to be something super
Keep the
expensive
stakes low. Yeah.
or out of the blue, something like that. Something that works as well. They sell in stores like Home Depot or Target, like little tents that you can plug with a light in the corner of the room, so that it's a sleep fairy house. So when
Yeah.
the kids wakes up in bed, sleep through the night in their bed, the sleep fairy comes and gives a little present.
Cute.
When it doesn't happen, the sleep fairy doesn't happen. Also, it happens sometimes in other latitudes. Here we have pretty much the same daytime and nighttime duration through the year, but in
Right.
places where it can be way darker in the wintertime, the kids wake up and they don't know what time is it because they don't know how to see the light. So then
Good.
you can train the kid with a light with a timer
Right.
and say, okay, when the light is on, then yeah, we can, the light
wake up.
starts in the house, you can get out of bed or whatever. If the light is off, nothing happens. And
Yep.
also that with a little price.
Yeah, that's good. That's good. Yeah,
Mhm.
anything to stretch out that that time.
Yeah.
Okay, here's another question from the
Okay.
audience. Oh, I'm sorry. Go ahead, Dr.
Oh, just to kind of also add to that, specifically in that instance, I would carry them back to bed, put them back in their crib, back in their bed, to kind of let them know, like, my love, you don't sleep here, you sleep in your own room, and kind of re-emphasize that each time, bring them
Yeah.
back to their room. And I love the idea of like, we don't get out of bed until the fairy tent or until the sunlight lamp turns on. We stay in bed until that time.
That's right. And I will say it is hard to get up in the middle of the night and take that kid
It
back.
is.
But think about it, it's much harder to break a habit that we continue for months and months and months. Cause yeah, but so much grace for parents. It's so hard. But good habit training goes a long way. I love what you're sharing there. All right, here was another question from the audience about layers for children. So smaller kids that don't necessarily use blankets, how thick or thin should the PJs be? She says she's always worried that her baby might be cold. So how do you know that we're dressing our children warm enough at night?
General recommendation in general for clothing for babies is one extra layer compared to the parent. So if it's cold and you're wearing a sweater, they should be wearing a thicker pajama on top of the swaddle. I agree, definitely no blankets in the bedroom or in the crib below the age of 1. In Miami, it doesn't typically get very cold where we would require fleece pajamas. And so there is a risk if a baby is too warm to go ahead and not put those extra layers on. But typically the one thin pajama, cotton pajama, with the swaddle on type is typically sufficient. And again, temperatures ranging between 60 and 72 in the home.
That's great. Great. Thank you. All right. Here's another question. I've heard of parents giving their children, melatonin gummies or sleep inducing medications like slip them a little Benadryl before bed, something like that. Are there dangers associated with melatonin or other, medications that aren't meant for sleep that are being used to help them sleep? Dr. Tapia, you can take that.
Well, the important thing is that melatonin is not regulated by the FDA in the United States. It's a
Interesting.
supplement.
Okay.
So it means that what you buy today may not be what you buy tomorrow because they don't have the same degree of consistency of checking that everything is fine, like if you buy a medication. So that's important for families to know. Melatonin could be okay to use for the short term. However, in the long term, it has been studied mostly in certain group of children with developmental disabilities or things like that. But in a child that is otherwise typically developing, it doesn't have a chronic role. Also, I would advise families against using it without a physician on board, because also as it is not regulated, the doses are all over the place. And sometimes you have people coming to the office with large doses of melatonin, which aren't really recommended for kids.
Yeah.
Benadryl is not meant, it can cause sleepiness, true, but the effect wears off if you're going to use it chronically. So if there's something specific that the child has trouble sleeping 1 or 2 nights, I mean, that would be fine. However, if people are using liberally for something else, then no, they would rather talk to the pediatrician about it or
Yeah.
consult with a sleep specialist.
That's right. Yeah. It's not a sleep aid.
Yeah, no.
Great. Okay, let's circle back on the noise machines, the sound machines. Do they really work and do they actually improve sleep? I use them for my baby, but sometimes I think, man, I don't know how I couldn't sleep with all this. I like want this noise off. So tell us what the research says.
The research doesn't indicate that kids that use the noise machines sleep any longer or any better. So again, it's really boils down to family preference. With the emphasis on kind of safe sleep habits. We do recommend, again, 7 feet away from the bed, no more than 50 decibels, kind of the sound of a quiet dishwasher. And we typically like to use it for sleep onset, maybe to help them if they need it. Again, it is a behavioral thing. And so if they're accustomed to hearing the white noise machine each time they go to sleep, they'll begin to require that.
Yeah.
And so it can be a challenge to eventually remove the white noise machine because it's a behavior that's up. And so we recommend keeping it low, keeping it far, and with the ultimate goal of discontinuing it. But yeah.
No, that's great. Then becomes like a sleep prop, right? I mean, if you have it forever,
Yeah.
like
Correct.
other things, to
And
be rocked, to go to sleep or whatever, then you like have all these things you have to do.
right. And exactly. And you have all these things that are required to actually develop sleep patterns.
Yeah, that's good. Okay, here's a question from our audience. I like this. The 8-year-old doesn't see the priority to sleep. She just wants to read all night, which I think is precious, but also you have to sleep. So she said, do you have any recommendation for this? I've started to tell her you will get old soon if you don't sleep to create a warning. So what can we be helping this mom with her 8-year-old who loves to read? I love that. But also she needs
I
to
think
sleep.
it's great that they love to read, that they should, really appreciate that. But also to put a limit, like in
Yeah.
anything, the parents, unfortunately, are ruling our life until they're not anymore.
Yes,
So,
that's right.
so it's put the limits. Okay, that's amazing. So you have 30 minutes of reading and then bed.
Yeah,
Yeah,
that's great. Set a timer. Here's your timer.
yeah.
I will say one thing, maybe just as a mom tip for this mom, we use visual timers. You can get them for $8 on Amazon, but get like a little visual timer, it turns blue and then the blue goes away and then
Yeah.
it can ding or not ding. But maybe she has something like that where she's getting that awesome privilege before bed. But when the timer's done, then she just turns her light
Yeah,
off.
it's that.
But that's a great lifelong habit to practice
Yeah.
reading before bed. So that's awesome. All right, let's talk about screen time before bed, how it affects our children's sleep, but also, our own. This is all good stuff for us too. And what are some healthy strategies for technology at bedtime, Dr. Henry?
Yeah, managing screen time is a lifelong lesson, and we like to teach the kids young. It's almost unavoidable at this point, and so really instilling strategies and skills on how to limit screen time. The AAP recommends no screen time before the age of 2, and then after that, maximum of 2 hours per day. And we recommend that it's always educational. PBS is always a great resource for those shows. Um, it's especially hard, I think, in the adolescent range and even into elementary school now, where so much of school's kids' schoolwork is on the screen. So we don't typically count that in the 2 hour range. And I give a little bit of leeway for that. But research does show that screen time before bed does have an impact on both the sleep when they actually go to sleep, their sleep duration, and the quality of their sleep. And so we really want to limit screen time. So no screen time an hour before bedtime. This can be particularly challenging, I think, for the adolescents. Before you know it, you're on your phone for a couple of hours and it's 3 a.m. I hear this
Yeah.
all the time in clinic, and the adolescent doesn't realize it and they stay awake so much longer than they really should, and they still wake up at 6 a.m. for school. So, really pulling away the screen time. We recommend no screens, no TVs in the room for all pediatric patients.
Yeah.
And yeah, it's a tricky balance. You can put automatic limits on the phone. Many devices have built-in limits that we can use as parents. So we recommend those for sure.
That's good. That's good. The theme I see with all of this, is just as parents, we are our child's best advocate. And sometimes that requires us setting strong boundaries, and that can be hard. I'm speaking like it's hard. I'm waking up my baby every night, feeding her, put her back to sleep. So I'm speaking to myself, but just the importance of whatever our family values and what we're choosing, but sticking with that and holding our guns on our the limits there. So that's good. Thank you. All right, Dr. Tapia, you spoke to this a little bit earlier, but when should we graduate our child to a bed? You said graduation, high school graduation. So we're not going to do that.
I think the later the better, honestly. It
That's
will
right.
depend on the size of the child, but as long as the child fits in the crib and it's comfy there, get him in the crib.
Yeah.
When the child doesn't fit there anymore, you can graduate it to a toddler bed, but I still would advise to have some bars on the toddler bed to ensure that things are safer for the kid and also
That's great.
and to prevent getting in bad habits, like getting out of bed or going to the parents' bed or things like that.
Yes, that's right. Talk to us about, we spoke a little bit about this, but if our child is waking frequently at night, but then also what if our child sleepwalks? And that can be scary as a parent if
Yeah.
you don't know, and then you wake up the next day and then you find them in the dining room or whatever. Talk to us about that.
Yeah, well, so sleepwalking is benign. Typically, is an inherited disorder, so many in the families may have had it, and it's triggered. This is very important. Is triggered by lack of sleep. So many times, parents will tell you, "Ah, you know, we went on vacation, and they had a sleepover with the cousins, or the grandparents, or whatever, and they noticed that the child was sleepwalking, or things like that." So the treatment would be one. The most important is to keep them safe. So that would be depending on the age of the kid, making sure if for example, if the kid is on the top of a bunk bed, not a good idea because you don't want them to bunk. So actually, you can put the mattress on the floor, so if they're gonna get off bed, at least they don't have like a huge thing there. Make sure there's nothing obstructing their path, and also if the house has several floors, it would be important to put some sort of alarm at the door of the child, and that could be simple like a bell, for example, like a mechanical bell. So if you open the door, if I move the door, I will hear it, and that will alert the family to make sure that the child is safe. If the child is caught during the sleepwalking event, they can walk them back to their bed. They're not fully like awake, so they can walk them back safely to their bed. But the treatment would be to extend a sleep duration. So they can start going to bed 30 minutes earlier, and things like that in order to have adequate sleep.
That's awesome. I've never heard or understood that it could be a result of needing more sleep that they're
Yeah.
getting. That's interesting. We at on Christmas Eve, we hang jingle bells on all our children's doors so that they don't sneak down before, everything's ready to go. So I don't know, might be a little easy thing to do if your kid is waking up. This is great. Thank you so much. I saw a question that came in earlier in the chat, and I'm just going to grab it. But circling back to a 6-week-old, and the mom is asking for some tips on soothing feeding schedule, and is carrying too much or napping on the chest when supervised bad at 6 weeks old.
So you have to just be safe. I think that's the most important thing. As a mom, contact napping is like, especially in the infant newborn period, it's like the most wonderful thing. You just really have to make sure that you're awake, and that you're not falling asleep. There's a very high risk to drop the baby, roll over onto. You have to be awake at all times when carrying, and you can't spoil a baby. You can't. So is a wonderful thing. It helps to also establish breastfeeding. And so at the 6-week age, it is okay. We do like to recommend into like the 1 month, 2 months time period. So you're kind of getting into that time frame of really establishing sleep associations with the crib, with the bassinet, to help their appropriate sleep associations so they don't require a parent to sleep on each time they go to sleep. So really the drowsy but awake method can be very helpful in this environment. She's on you or the baby's on you, and you soothe them, and then you, as they're just about to fall asleep, you put them down so they know where they are. They don't wake up startled alone. And so contact numbing is okay. We do want to kind of limit that once they get into like the 2 month age range. They should really associate sleep onset with their own crib.
That's great. Thank you. Yeah, there is nothing sweeter than that little feeling. Just be very awake and alert. Okay, let's talk about Dr. Henry, a child that's been waking up from having nightmares. Like, what can we do to help? And how is that different for maybe a little child, versus someone bigger? Like, are there different strategies?
Yeah, so they're actually pretty similar overall. It's really just like supportive care. So nightmares will typically present as early as 6 age, tend to peak between age 3 years to 12 years. Those children typically wake up afraid. They know what's going on. They know that they have had a bad dream. So we recommend to immediately go to your child, soothe them, really reassure them, I'm here, it's okay. Depending upon their age, explain dreams aren't real. And if there's specific things that they're afraid of in the room, like certain shadows, you can reassure them that, the boogeyman, we got rid of them from under the bed, and you can do a whole ritual with that. But we really overall try to encourage them to go back to sleep kind of them, and once they're calmed down and once they're ready. Something to note, there's something called night terrors, which looks a little bit different. These are the moments in which a child wakes up. Typically happens in the toddler and preschool age range. They wake up, they kind of cry uncontrollably. They may not even recognize you. They have this kind of scared and glassy look. They'll even try to push you away. So the night terrors, kids aren't aware of them. Dreams, you're aware of. You wake up, you're oriented. These night terrors, kids aren't really fully awake, is how we like to. In these situations, the main support is to stay calm. These children, again, they're not really aware. You want to make sure that they're safe, that they're not like hitting themselves or doing something dangerous. You want to like gently restrain them, and then eventually relax and fall back asleep, and you just put them back in the bed. For those types of things, definitely warn the babysitters in the home. And if this continues to happen, I would bring it up to your pediatrician.
Yeah, that's great. Yeah, we've experienced that once before, and it is just wild. You feel it's scary to see a child experience that, but it's good to know that it's not harming them. Okay, let's talk about Dr. Tapia. Let's talk about snoring or maybe mouth breathing sleepers. Like, is that something to be concerned about? Talk to us about
Yeah, actually, it can be concerning. It depends on the frequency. For example, typically if a child snores when not sick, more than 3 nights of the week or a 3-month period, it would be important to seek attention. And also if the child has mouth breathing while awake. Mouth breathing during sleep is a little bit more common, but if you are mouth breathing also during wakefulness, it would be important to check if there's something obstructing the airway. And that is important because snoring that affects about 15% of children is pretty common. It's a marker of obstructive sleep apnea. It doesn't mean that all kids who snore will have obstructive sleep apnea, but it's important to check that out because that has a treatment, and that can improve a lot of symptoms that the child may have. Some of them may have even been not noticed by the family. Also, there are recent research that shows that snoring is not as benign as is was thought to be, like snoring chronically. So even if the child does not have obstructive sleep apnea, it would be important to check that out to see if some treatment needs to be done.
Okay, that's helpful. What are like some common sleep disorders in children? And at what point should you, like a parent says, oh, like, should we get that checked out? Like, what are
Yeah.
some signs and symptoms?
When snoring, obstructive sleep apnea, the breathing disorders, they're very, very common. Typically, obstructive sleep apnea happens between ages of 2 and 8, a little later as well. It coincides with the growth of the tonsils and the adenoids. So when they're very large, they can obstruct the airway during sleep because we're all sort of floppy sleeping. And that's one of the things that happens. And because
That's what's obstructing when, I'm sorry
yeah,
to interrupt you, but
was
okay, it's
obstructed.
like the tonsil or the adenoids.
Yeah, it's something anatomical, but it's not
Ah,
the only cause.
okay.
I don't want to make things more complicated, but there are many kids with large tonsils that don't have those issues. So you need
Okay.
like a combination. But
Okay.
let's say your
Yeah.
child has the issue, it's important that it gets treated because during the periods of obstruction, you can have like low oxygen periodically during the night, and your heart start to race hard to overcome that
Mm,
obstruction. And that if you're having that night after night,
yeah, that's a
month
lot.
after month, then it can have some consequences. Like one is symptoms similar to ADHD. They can have a problem focusing at school, also problems with the blood pressure or the heart rate in the long term if things are not corrected early on.
Okay.
Other important sleep disorders are restless sleep. For example, if a child is very restless, moves a lot during sleep, or when the parents note that the kids are sort of kicking their legs during sleep, can also be a marker of low iron. So we encourage the family to seek attention for that, because we can do a blood work and see if something's going on, and maybe they can get iron supplement. It's not that complicated with that. And also that the behavioral issues that we already talked, like for example, sleepwalking, or some people have sleep eating, night terrors, are along the same lines.
Okay, that's helpful. I'm thinking just, as a parent, I don't always know. I'm thinking of, my older children. When they go to sleep, I'm like, they're asleep and they wake up the next morning. But it'd be good to, just kind of even monitor our older kids to know, like, how do I know if you're
Sure. Yeah.
restless sleeping in the night or, kicking your legs a lot? That's helpful info. That's good. Okay. And so then at what point, I guess, should you see a doctor or, get an assessment or a sleep
Yeah.
study?
I think if someone is, for example, having chronic snoring over 3 months when they're not sick, when they're
Okay.
totally fine, but having that, or they're breathing through their mouth while awake, it would be important to
Right.
see a doctor. Yeah,
Okay.
to find out what's going on, and then we can have a sleep study and things like that. And then we have an objective assessment of what's going on during the night.
Okay, that's great. All right, audience, we have just about 10 minutes left. So if you have a specific question, please drop those in our Q&A and I will get them in front of Dr. Henry and Dr. Tapia. I have a few more questions. So let's talk about napping, and around what age should a child stop napping? And then every parent fears, like, is this going to impact their night sleep? So talk to us about napping.
So napping typically starts to, the need for napping starts to resolve between ages 3 and 5. So it's not something that is set on stone. Some kids,
Right.
one day they will not nap anymore and they do fine. Some others, they start to wean slowly. For example, they may still nap 3 nights of the week and the others, they don't need to nap. And napping can affect the overnight sleep duration, depending if the child is sleep deprived and still needs that nap time. And sometimes the parents said, okay, no, your brother or your sister stopped napping at 3 years and you're 3 years and 1 month, so no more naps for you. But it doesn't work that way, right? So in those cases, some kids will need a little bit of a nap or a shorter nap.
Right.
In
That's good.
general, for a kid who naps, who still naps, and misses that nap for whatever reason, the family is traveling, they're visiting friends or something like that, you will notice overnight that as Dr. Henry mentioned, the child will be very wired up at the end of the night, most likely of the end of the day, because most likely the child is already super tired and needs to go to sleep, was missing that nap.
That's right. Wired means tired.
Yeah.
I'm taking that away. I have a 4-year-old and we're kind of in that window of some days it's good to take a nap and it makes bedtime, a little bit more challenging, but he needs it. And then, sometimes he doesn't and we're at the dinner table and he's so wired. I think you needed that nap.
Yeah, and also when the child said when you're winning the nap, you can shorten the nap a little bit, maybe 30
right.
minutes, fine. They don't
Oh,
need
that's
to be
good.
1 hour or 2 hours. So you still get a little bit of the nap, but you don't let it go like forever.
That's good. Yeah. And just wake them
Nap,
up. So they're good.
Yeah.
yeah, and along that lines, nap time should end at least 2 hours before actual bedtime.
Yeah.
Yeah.
We don't want to run into the bedtime
For
zone.
sure. For sure. I'm gonna say, get back
And
to sleep.
that's
Okay.
very important for teenagers because they come back from school and many times they can take a nap. I mean, that would be okay, but sometimes they tell you, oh, the nap is like 3 hours, and you're thinking like it's already like dinner time at the child you
That's
wake.
right.
Yeah, so be shorter.
Yeah, you're not going to stay on your phone till 3
Yeah.
a.m. because you took a nap. That's right. This has been so incredibly helpful. Thank you both so much. Such info. Yeah, our audience is saying as well. Thank you so much from a sleep deprived new mom. I love that. So welcome. We're glad that you were here today as a sleep deprived mom. All right, let's kind of wrap it up with those who may have teens. So this question is: our teens seem sleepy even after a full night of sleep. Should you be concerned? And should you allow them to kind of catch up sleep on the weekend? And is that even a thing? Like, is it true that you can catch up on sleep?
I mean, it has some truth to it, but the most important thing in sleep is to have a sleep regularity. So you don't want, again, we'll go back to the routine. You don't want to sleep 6 hours tonight, 10 hours tomorrow, 2 hours the following, 24 hours the following, and you see those crazy things. So it's important to have a consistent bedtime and rise time as much as possible. So if a teen is sleepy, yeah, I would be concerned. And most likely the teen is not sleeping that much. There's something that called delay sleep phase that is sort of normal physiologic when we're in teen years, that we have the need to go to sleep later. But school starts early, so it gets sort of in the way. And also they have so many social things or sport things, and then they're texting their friends. And we talk a lot about association, but some people have a really association with the phone. So they need to know what happened on TikTok now.
That's right.
It's
Yep.
and many times it's not that important
That's
in
right.
our view as adults, right? So it's challenging to make that come across. So what is important is to have a consistent bedtime. And during the weekends, they can sleep a little longer, but I wouldn't let them sleep more than 1 or 2 hours compared to the typical rise time, because otherwise you're creating, let's say, it's like you're traveling to California or changing time shifts for the weekends and coming back here, and you're never going to be in any time zone.
Yeah, that's right. That's right. Yeah, good point. And we have a whole episode on screens. So check out our resource there, Parental Guidance Org. Just put a plug for those of you who want to listen to that one as well. This was incredibly helpful and insightful. Thank you so much, Dr. Henry and Dr. Tapia. We're going to put some resources here on the screen. If you guys want to do some further study on your own, there's some recommended reading as well as a great website. So you can screenshot this to have these great resources. I just wish everyone happy and wonderful sleep tonight, whatever everybody has going on in their particular situation. But also, I want to draw to your attention our next parental guidance webinar will be Thursday, January 16th, and we are talking about picky eaters. So is mealtime a constant battle for you with your picky eater? Are you exhausted from trying to get your child or your children to try new foods? Join us for an insightful webinar that takes on these common struggles. We're going to have a pediatric nutritionist, and this interactive session is really going to provide you with actionable strategies to implement at home. So you're going to have, helping make your mealtime more enjoyable, and we're going to focus on practical advice and real world solutions. That's what we need, right? That's what I love about this time is it's really take away things you can go and implement in your family tonight. So we're going to have our experts answering your questions throughout the session. You're going to leave with confidence and knowledge to support that picky eater. So don't be discouraged about picky eaters. Please join us. That is an opportunity you don't want to miss. We're going to learn from the leading authority in pediatric nutrition, and you are going to be an informed and proactive parent. So that's happening on Thursday, January 16th at noon, right here again. So you'll get an email and watch social media for the reminders. As always, again, parentalguidance.org. You can have this webinar will be there. Give us a little bit of time and you could share it with, a spouse or a friend that missed it. And you can also check out the archives there for all of the other episodes.